103, bed 4, Frank Ashley, admitted with rheumatoid arthritis, stable condition. Are there any updates?
So I'll begin. I saw Frank last week, and his primary complaint at that time was that his pain was worsening. And I can confirm, in my expert opinion, that I think it has gotten progressively worse, particularly over the past few weeks. We have had Frank on a fairly stable medication regime over the last 6 months. However, we feel like we don't want to tamper with this at this time, because we're thinking that increasing the dosage probably wouldn't be the best route to take. So we're kind of hoping that maybe you guys have some creative ideas as to how we can help sort of manage that pain without having to go in and change his medication regime. Does anybody have any ideas?
Don't really have too much to add to that. As I said, we're just kind of keep the medication kind of where it's at. However, I mean, the last time that I met with Frank, he was seeming a little down, and he was mentioning that due to the pain and stuff like that, he's having a really hard time maintaining employment. And it seems to be, like I said, getting kind of down, and I'm kind of starting to worry about depression, so I'm just kind of keeping an eye on him there. And so I guess at the next meeting, I'll kind of update you guys on the progress there.
Physio, have you seen anything?
Yeah, I did an assessment on Frank earlier last week and just sort of provided him with some exercises to try and help with his hands and wrists, and he seems to be complying well with those and doing them as often as I ask, so I think things are going pretty well that way.
So I guess I'm interested in the pain management, so OT, anything to do with that?
Yeah, taking into account what everyone has shared in the room, pain management seems to be the primary focus moving forward with Frank's treatment. Based on Frank's current pain levels, I'm going to assess him for the use of a wrist splint. This will help immobilize the joints of the wrist and hopefully reduce Frank's experience of pain. I had mentioned using a splint to Frank during our last meeting, and he expressed concerns regarding the functional impacts of a potential wrist splint. I decided to complete a critically appraised topic to better inform my understanding of the functional impacts splints may have. Interestingly, although, many practitioners prescribe wrist splints in an attempt to improve hand function among individuals with rheumatoid arthritis. The results of the 6 studies I reviewed did not fully support this relationship. Although there were trends in favor of this relationship, most of these relationships did not reach clinical significance, nor were they consistent across studies. Conversely, 4 of the 5 studies that investigated the impact of wrist splints on pain support the use of wrist splints in pain management. Therefore, if it comes down to actually prescribing a splint for a client, we need to exercise caution, as there seems to be no clinically significant reason to prescribe solely for hand function. We need to exercise caution during the provision of splints, because a decrease in pain is not necessarily correlated with an increase in functional ability. All right. So, however, clients should be made aware that in addition to being useful in the management of pain, their splint may also slightly help improve hand function. However, this cannot be said definitively.
Okay, so you're saying it's good for the pain, and you'll have to see where it goes in terms of the hand function.
Yes, absolutely.
Okay, that seems like probably a good course of action.
I think so too.
You agree?
Everyone's in agreement?
Yeah.
Excellent.
And you'll provide that information?
Yeah, we have a meeting with him here coming up in the near future, so I'm going to explain that all to him then.
Okay, perfect.